Eric has 6 porcelain veneers and 2 crowns on his upper 8 maxillary teeth. And one of the things that we've noticed over the last couple of weeks is a little bit of staining on the back side. Those are still his natural teeth, and he does drink some wine, soft drinks, is a coffee drinker. And so we've done what we call renewing veneers. And this has been around for quite a while. We've done this throughout the years with other patients where we've just had really simple veneers placed. We've actually bleached their teeth from behind. And one of the things we're going to do for Eric over these next 2 weeks is we fabricated him a bleaching tray, and I'll show you how we block that out. And he's going to wear that every night while he's sleeping and hope to get not just a lighter tooth structure, but that lighter tooth structure shining through those veneers. Now, his lower arch is natural, so we don't have any restorations on those. And I'll show you what we've done. We basically took an impression, and you'll see here, of Eric's maxillary arch here. And basically what I did is I placed some blockout resin, and I just kind of placed that from behind to give him like a little bubble back there. What that's going to do is actually hold the bleach in place at night while he's sleeping. And we just kind of made a little reservoir. We did a suck down, and we didn't cut this out. Studies have shown that there's really no difference in the bleaching whether you cut out the papillas or not. And we just find the tray is actually more stable when you don't. And so we've got a bleaching tray for the maxillary arch here, and I'm just going to kind of peel that off and show you what that looks like. And again, pretty neat little idea. We've been doing this again for a couple of years, and what I'm going to do for Eric is just kind of show him, Eric, what we're going to be doing at night before you go to bed. We've got the Venus bleach here. We're going to be giving Eric a 16%. We want to make sure he doesn't have any sensitivity, especially since he's going to be sleeping in it. And with the Venus white, one of the things that I want you to think about is you don't have to overload this. We don't want patients just squeezing a whole bunch of material in there. You're just going to gently put a little bit of material, and I'll demonstrate that. We're just going to kind of load the syringe here. And again, if you put too much, it's going to seep out anyway. So our main objective is to get it on the lingual side of those restorations. Remember, he has porcelain on his front teeth, but they're really simple veneers. So we're just going to kind of place that in there. And Eric, I'm going to have you just open for me. And we're just going to kind of seat that over his restorations. He's going to kind of wear that just like that. Does that feel pretty comfortable to you? Mm-hmm. Okay, so now what we're going to do, and again on the lower, we're going to do the lower as well. We've got his lower bleaching trays. I'm just going to kind of peel that off, and you'll see that tray. And I'm going to go ahead, and one of the things I always do is I demonstrate to the patient how much material we're going to put in the tray. So I'm going to go ahead, even though I know that we're going to have Eric sleep in these, I want to make sure that he knows how much material to use, because we've had patients call us back that have overloaded it. And one of the things we've taught our team is every time we deliver trays, we want to be able to do that first bleaching session right here in our chair. So I'm going to put that in there and just kind of put that to place. There we go. And I always ask my patient, does that feel comfortable to you? When you run around with your tongue, does it feel any sharp edges? Everything feels pretty smooth?